So I tried the Freestyle Libre for the first time for my reactive hypoglycemia, and to put it bluntly, it didn't go well. I'm not okay. And I wasn't going to share this video because it's extremely vulnerable of me in a very vulnerable position. But I wanted to share this video to talk about disenfranchised trauma. For those of you who feel a little bit like me, I want you to know that you're not alone and how you feel is valid. As someone who's in the cystic fibrosis community, I know countless of people who go through medical procedures, long lines, PICC lines, ports, without seemingly too much bother. For me, it's very different. It almost feels like I'm not a good CFer, which is utter bollocks because we all have different experiences, different reactions, and different backgrounds. So if you're a little bit like me, my intention here is to reassure you if you're also really bad with needles, whether you have a chronic illness or not. So when it comes to cystic fibrosis, there are certain medical procedures that you have to go through. Most people experience IV antibiotics through PICC lines or ports, which is inserted into their body to deliver liquid medication to combat infections. Most people also have to endure regular blood tests, and I've also had a couple of bronchoscopies where they stick a camera down your throat and have a look at your lungs. Fun times. My mindset for a very long time was I shouldn't feel distress when a lot of other people have it a lot worse than me. Like, some people go through lung transplants and I'm over here being like, oh, blood test. So I'd push it all down, try not to complain, and carry on with life. But unacknowledging a problem becomes a very serious problem in itself. I was comparing my experiences to someone else's, and in doing so, limiting my beliefs and unintentionally telling myself that my struggles are invalid. I'm almost scared to use the word medical trauma because in comparison to a lot of other people, it might seem a little bit far-fetched, but I'm not a mental health professional. But what I do know about trauma is it is diverse and it is subjective to each individual. I always thought that trauma was like reserved for the highly distressing things in life, but it's not until recently did I realize that it's more than that. It's an umbrella. I also suffered in silence because I was afraid that people wouldn't understand the mental pain and therefore minimize the suffering. And this, from what I understand, is called disenfranchised trauma. To explain this a bit better, I'm going to talk about disenfranchised grief, which is when we minimize the grief because in comparison to someone else, it's not perceived in our society as really that bad. Let me explain. So a clear example of this is when someone loses a pet. That can cause immense pain and suffering, but when we compare it to someone else who's lost an actual person, we push that grief down because society tells us that it doesn't quite match up. It's not socially validated or supported in the same way, so we push the grief down. This is called disenfranchised grief. So disenfranchised trauma is when we minimize the traumatic experience because people have it worse than me, when in actual fact, your experience is valid. I think medical professionals can normalize these medical procedures because they are repeatedly desensitized to it because they do it every day. But I feel like this forces you to divert mental pain, or at least it did for me, because I know I have felt like a baby, like such a wuss when I have been terrified about having IVs before. I felt like I was expected to just get on with it and just accept it for what it is because I can't change it, I can't not have it. But if you take anything away from this video, take this. If it hurts, it's valid. And we need to normalize the fact that it's okay to struggle with this. Just because you have CF or another chronic condition and you go through medical procedures all the time doesn't mean that it can't be negatively weighted mentally. The first step to overcoming a problem is acknowledging it's a problem in the first place. And when I was in those medical procedures, whether that be a long line or a blood test or a cannula, I would visibly be showing that I was in distress. Quite often I would be a crying mess. And instead of the nurses acknowledging that, they would often divert the conversation. They'd ask me about my day, they'd try and say something funny, or they'd try and distract me with something else. And it never worked. And I understand that it's really hard for nurses in that situation, but I think for me, by unacknowledging my mental pain, my needs, it made me feel very insulted because I didn't feel seen. I didn't feel validated or supported. And receiving this kind of response as a child created complications for the future. When I went into hospital, I was 9 years old, very unwell, and they were like, hey, you need a cannula in your arm for 2 weeks. And I was like, hey, what's that? I had no idea what a cannula was. And they said, oh, it's a needle that goes in your arm to deliver liquid medication to make you feel better. And that needle stays there for 2 weeks. For someone who's already scared of needles, this was bad news for 9-year-old me. They straightened my arm and they tried to distract me with other things, and I was holding my dad's hand so freaking tightly. He was trying to reassure me, but I was in panic mode. Oh no. oh no, oh no, oh no, 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 kind of thing, but less humorous. One person was holding down my shoulder, another one was straightening my arm, and another one was searching for the vein, and I was terrified. Here's the thing with trauma, in its most simplest, basic form, trauma is when your nervous system gets dysregulated. Your whole body turns on an alarm. Everything is on full alert. Everything is notched up to the highest level, and our brains start to record that in hyperspeed, in 4K, because it wants to protect you in the future. And the chemical reactions that are happening in our brain and body is recorded and then stamped into our memories. So often when we are in a similar situation in the future, or we're looking back at that experience, we start to feel the remnants of that experience, the residue that was left behind. We start to feel the panic and the distress. So going back to little 9-year-old me in this highly distressing situation, I recorded that experience so thoroughly that when I was in future situations, like having a long line put in, my brain and body would revert back to the experience of 9-year-old me and all of the emotions that brought up. And here's the thing about cannulas, because it is a needle stuck into your arm, I was told explicitly to not bend my arm. I even had a splint for my elbow so I wouldn't bend it. I was so scared that that needle was gonna like puncture another vein or cause more damage or anything like that. I was terrified. Not until making this video have I since learned that cannulas aren't sharp like needles are. I'm 28 and I've just figured this out, but little 9-year-old me had no idea. I thought that a sharp needle was staying in my arm. Also, in researching for this video, just looking at pictures of cannulas has caused my body to feel the same reaction to how I felt when I was younger. Your body remembers. And I think that's really important to remember as I show you the following footage of me applying the Freestyle Libre onto my arm. And as a side note, I filmed this back in September 2021, so if I look a bit different, my hair's a little bit shorter, that will be why. So today I'm gonna put on the Libre, which I'm very apprehensive about. I mean, let me just put things into perspective. It takes me a long time to finger prick myself. Every time I go to do it, I freeze and I'm just like, and then I do it and I'm like, oh, that wasn't bad. If you did not know, I have reactive hypoglycemia, which I did a whole video on. I recommend go and watch that. And I spoke to my diabetes nurse recently and she has sent me out a Libre. One of those thingy things where you put it on the skin and then you scan it with a phone and it's like, boom, there's your blood sugar without having to finger prick all the time. And I'm really excited to try it and see what my blood sugars are doing, because sometimes I feel like they're all over the place. They've got a mind of their own. Apparently it's only like a thin, like little needle. Is it even a needle? It's like a hair thin thing. Moving on. Let's go and put this Libre on. I'm gonna take you downstairs. When was the last time I did a casual kitchen chat? I cannot even remember. Let's put some lights on. Let's get in the mood. So this is the Libre. Fun. We've got 2 things and we've got 2 pre-injection swabs. Oh, this isn't good for someone who hates needles. Step 1, select site. Choo, 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 choo. Wait, where do I put it? It doesn't even tell me where. I think I'm gonna need some help. Who in my contacts has CF-related diabetes? James will. James will have it, yeah. James does have it, yeah. Let's message James. Hi, how are you? Help me! Exclamation mark, exclamation mark. Should I just do it all around? Should I just do my whole arm? Is it gonna hurt? I've kind of just swabbed everywhere at this point. Step 3. Ooh. Oh my god, that looks like a needle. We're just gonna take this one step at a time, literally. It's okay, Kate, we no need to panic. Oh my god, I'm starting to shake. And I twist it. Which way? Not that way. This way? We're done step 3, okay.
How's it going, John?
We're on step 4.
Which is?
So I've got to line up the things with the things.
In your left hand. Fuck me. Can you not see the notch? The grey mark?
That grey bit? There, okay.
That grey bit. You got to line that up.
Yeah.
There's a grey line.
Is that what it says? Are you sure?
That's it.
And then
push
what?
it in.
I cleaned the whole arm. I didn't know where to do it. I just cleaned it all.
Just made it dirty again by touching it.
Do I need to clean it again?
No, I'm worried, but...
Pro, and I.
You either won't feel it at all or it will sting a little bit.
When you say sting a little bit, is this the thing that nurses say when they say sharp scratch just before a blood test? And it's not a sharp scratch.
Yes.
Right, okay. Oh, I know, I've taken it out.
Right. Don't look at it.
Okay, this might take me a few days to do.
When you do it, I think you've got to do it you just got to go for it one swift, because it's like a mechanism, a spring that puts it on there.
As soon as I saw that needle, I was straight back to 9-year-old Kate. Anxiety skyrocketed and I was trying not to cry because I was on FaceTime to James and I didn't want him to see me break down over a needle, which he applies the Libre every 2 weeks and he injects himself. So I was pushing all of that down, pushing all my trauma down, and what do we call that again? I'm having second thoughts.
You can't put it back in there.
I can't put it back in there?
I think you just got to do it because the sticky's ready to go now as well.
I genuinely thought it was going to be like a hair-thin needle.
Well, you shouldn't have looked at it, should you? That was your mistake, really.
That is just mental. I was utterly convinced that needle was going to stay in my arm for 2 weeks. It doesn't, it turns out. It just makes the hole for the sensor to go in. But I did not know this. There was not one part of me that questioned that needle was going to stay in my arm for 2 weeks. Sound familiar? And ultimately, that was the underlying trigger.
Go on, just nail it on there.
So that whole thing's gonna... Okay, no, not gonna go there. Here is where I was about to say, so that stays in my arm for 2 weeks? But I couldn't say it because the thought of that was so unbearable and I was trying not to cry. But if I had, James could have reassured me. He could have said, no, the needle doesn't stay in. And it would have eased things. Well, I think it would have, well, I don't know at this point.
Just do it now.
No, I've got to go for this. I cannot have an audience.
See you later.
Thank you. I knew as soon as I saw that needle, I started to well up and I was like, oh shit. For someone who has a needle phobia, this is... I feel like such an idiot for being like this over that needle. I can do this. I can. No, I can't. Well, yeah, I can. Okay. God, so much anxiety right now. How do we overcome this, Kate? How can we make this easy? Well, we've gone off FaceTime. That's made it easier to do it in my own time and just to cry and panic in peace. Cool. It's like having IVs again. That was ridiculous. You can't compare it to that, Kate. What I meant by that though is like in terms of having a needle in your arm. This is like cannulus level. Oh, I'm not helping myself, am I? One step at a time. Okay, well we've got to the last step and now the next step is to place it about there and then push down. That's all I need to do. I just need to push down. What the fuck is wrong with me? Do I believe it's gonna hurt? Yeah, so if I believe it, it's gonna hurt, isn't it? Like, this is just like what I want, Kate. I can do this, I can do this, I can do this, I can. It's just like when they do a flu jab and they do it. But the thing is with a flu jab and with a blood test and with IVs, someone does it for you. Or maybe I need to go and blow my nose. Maybe that's the next step. We look around the room and we look for colours. Yellow, blue, green, kind of a golden colour, an orange. I get to have this sensor, advanced technology that I can check my blood sugars. It's amazing. That's incredible technology, Kate. Gratitude really just does calm my mind down a lot, doesn't it? Should we do it then? 3, 2, 1. 3, 2, 1. Right. Don't even think, just concentrate on the number. 3 and 2 and 1 you press, okay? 3, 2, 1. Fuck off, fucker! You fucking what? What the fuck? Oh shit! Oh shit! Oh shit! Oh shit! What the fuck? What the fuck? What the fuck? What the fuck? The fuck? Okay, that's blood. Okay, that's okay. What the fuck? Is it meant to bleed? Does it say anywhere about bleeding? I don't know. I can never have CF-related diabetes, can I? No. Oh shit, it's proper bleeding through. What the fuck? Should I be worried? Is it supposed to bleed? I need to Google, but I'm so scared to move my arm. Hi, is it meant to bleed? It can occasionally, if you're unlucky. It's only happened about 3 times. Are you okay? I'm not okay. I'm so scared to move my arm. What's wrong with me? I'm 27. I should be fine point by now, right? I honestly did not think that needle was gonna be like that. When they say, oh yeah, it only stings a little, it might sting a little. When I pressed it down, my whole arm went numb. It was the weirdest feeling. It kind of started tingling and went really numb. And then I realised it was bleeding and I was like, oh well, if it could not be any more traumatic for you, Kate, let's have some blood, why not? Let's just hope that it always stays as reactive hypos. Out of everything, this would make me cut out carbs. I will cut it all out if it means that I do not have to deal with reactive hypos or deal with diabetes. I'm not having carbs ever again. Oh, but it's lunchtime. I know this sort of reaction might seem a little bit of an overreaction or a little bit extreme to some people, but genuinely, like, I'm getting the same response, the same fear that I have when I have IVs. I went for a blood test the other day and I was saying to myself, I've come such a long way. Especially with blood tests, which, you know, I have to have like 4 or 5 of them a year maybe. I used to have freezing spray, I used to have numbing cream, like all of it, up until I went to adult care where they didn't have any of that, or I wasn't offered any of that, and I was like, what? So I'm just gonna have a long line put in without anything? That same sort of panic response that I would have to having a line put in is what this is coming out as now. I feel really stupid because I know people who do this all the time and it's not a big deal to them, but for me it's like, yeah, it's a big deal for me. So you came for a reactive hypoglycemia talk and instead you got blood, snot and tears. It's been an hour and my thing is ready to go, but I just feel so numb. It still stings. Now I'm gonna click check glucose and I'm a 4.1. I just feel really sick. So I haven't eaten anything, so 4.1, and there's an arrow that says that it's stable. But I think if I don't eat, then I might drop, so I'll try and eat something, I guess. I didn't film any more that day because I was so numb and so out of it. But basically the sensor didn't work for the first 12 hours. It kept saying I was hypoing and I was clearly not hypoing. But after that it did work, it did pick up, and I recorded a whole other couple of videos about what I eat with reactive hypoglycemia. So stay tuned for that. It is coming soon. From that footage, it's really quite clear how much I was impacted by the thought of having a needle permanently in my arm for 2 weeks. But I think it's really powerful that the brain can amplify a fear and make the physical pain of it 10 times worse. I'm sure you've all heard of the placebo effect. It's pretty much mandatory now to have a placebo when trialing out new medication. And that's because the brain influences the body to believe that the medication is having an effect. And I think it can happen the other way around. I think it can influence you into believing that the pain is way worse than it actually is. And I really believe that that's what happened when I put the Libre on. My whole arm went numb, it was tingly. The pain lasted for a good couple of hours. And in speaking to James, he doesn't get that. However you think of it, just understand that your feelings and your reactions are valid. If it hurts, it's valid. I actually asked James if I could film his next Libre change to show you how it all should be done. Okay, so first thing first, get your alcohol wipe. They used to come supplied in the pack, they don't anymore. So where'd you get them from now? Amazon. This is the area of wipe where it's going to go. How do you know where to put it? You're supposed to put it right on the back of your arm. My arms never used to be big enough, so the sensor would wobble around and eventually come off. Wouldn't last the 2 weeks, but now I put it there. You can probably see a rough patch. Oh yeah. This looks very familiar. 2 halves. PTSD already. Unscrew one half. Open up the other half. We've lined up there. There, yeah. And you just click them together. Now the 2 notches lined up, they're pushed together. You now pull them back apart again. See, the needle is now in the pack. Yeah, there it is. That huge thing. So now you put your big boy pants on, find it where you want it, which I'm going to go about there. So that's lined up, and you just press it on. Oh my god. Oh, that noise. And then I'll just gently pull it back and twist at the same time. Oh, you press it in? Yeah, we'll make sure it sticks. So the needle is still in there. Which is what I did. This bit's come forward to stop you stabbing yourself with the needle. Did that not hurt at all? No. Is that because you're like really used to it? Sometimes it hurts, sometimes it doesn't. This is the old one. Old one. And all you got to do, get your finger behind, just pull it off, mate. Oh my god. Yeah, it's very bendy. It's almost like a piece of foil, like really strong foil. There you go, that's how you properly do it. I really hope this video has been enlightening and helpful for you. If it has, let me know in the comments below, and of course I will see you in the next one.